Welcome to Healthdesk channel. I am Dr. Srilekha from Happy Smiles Dental Clinic. I am an oral medicine and radiologist, in short, a dentist. The teeth should be taken with utmost care because they are the gateway to our whole health. Today I am here to educate all of you regarding the common problems which we face in dentistry. Today we will talk about gum diseases. This is the most neglected as well as not aware for the patient. Gum diseases are something which the patient comes to a dentist only when it progresses to untoward problems and major health periodontal conditions. The gum disease is nothing but when we see light blood while we bite an apple or while we are brushing our teeth, we find blood in our spit. This indicates that our gums are starting to bleed and there is an initial stage of gum diseases. So this gum diseases progress into bigger problems like loosening of teeth and falling out of these teeth. This gum diseases is mostly neglected by patients thinking that this is a very common issue or it might be due to some minor issues. But this should never be neglected and the patient should compulsory go and meet a dentist in regard of these gum bleeding problems. So let us see why gum disease occurs. The gum disease occurs because of lot of calculus and tartar that gets accumulated on our teeth. What is this calculus and tartar? Calculus is nothing but lot of food deposits on the particular tooth will eventually harden and become hard plates. This looks like yellow teeth on your when you look into the mirror. Like when you open your mouth and see the lower teeth or the front teeth, you can find that there is a lot of yellow deposits on your tooth surface. This is calculus. If this calculus is not cleaned in a regular cleaning or a scaling procedure by the dentist, or this becomes more hardened, this is going to become like a niche for the bacteria to dwell. This eventually causes the gums to become red. And when this red gums are slowly abraded by by either a brush or when you try to bite something, these red gums will lead like a blood stains on that particular food product. So this is a minor problem in the initial stages. This can be resolved by properly cleaning and getting an oral scaling done by the dentist. This scaling prevents this calculus formation and will restore the health of the gums. But if this gets neglected, the gum disease progresses into a periodontal disease. Now this periodontal disease is the tooth starts loosening in its socket. So slowly you will find this one of your tooth or 2-3 of your teeth are becoming mobile, that is they are shaking and you are not able to put much pressure as you used to do before. So this indicates this is the stage 2 of the gum disease. Now stage 3 is the tooth falls out by itself because the gum loosens more and there is no much grip around the tooth and this tooth falls out by itself. This gum diseases occur in 2 phases. One, it might be localized, that is only 2 or 3 teeth might be affected, and second is all the teeth are affected. So why does this gum disease occur? The first thing as we discussed is because of the calculus that is formed and the patient is not getting an oral hygiene treatment or a scaling done before, or either he is not brushing or maintaining his oral health. The second thing is they get it hereditarily, that is they acquire it from their ancestors who already suffered with a gum problem. This can be seen in very young patients like below 30 years. If they developed a generalized gum problem, that is majorly because of their ancestral lineage, that is they have acquired this particular problem via hereditary. This can be solved by properly maintaining and the 6 months once dental visit, which can be maintained and the gum health can be restored. But if this gum disease is neglected, it can progress faster into a periodontal problem and the teeth get loosened and the gum becomes very weak. But as the patient ages, sometimes we see lot of gum problems in the senior citizens, that is people above 60 years. This is because of their systemic health. Systemic health involves diabetes, hypertension, and lot of liver cirrhosis problems and all. And also because of the medication they are taking. They use lot of medicines. Because of this, the gum becomes weaker, it becomes red and also bleeds a lot. These people should also be aware that the gum is showing a reflection of their inner health. So when they visit a dentist and the dentist detects that the gum is really in a bad shape, they can advise you to go for a blood sugar test or a hypertensive test. So all the diseases are related to the gum problems. As we look, the mouth shows like a mirror of what is happening beneath in your body. So the gum diseases are one of the most common neglected problems, which I really advise all of you not to neglect it. And please make a visit to the dentist every 6 months to prevent these untoward problems. Thank you.